So I have already identified my patient in 2 different ways. I have introduced myself, I have provided privacy for the patient, I have checked the physician's orders, and with that I have educated my patient on the procedure, I have gained their verbal consent, and I have also checked for any allergies. I have also brought the bed to a working level for myself. I have the patient already situated for the procedure, and I have provided perineal care as well. And I have ripped the tape already ahead of time, so I'm going to put that over there. And then I'm going to do a little hand hygiene here. Oh, I'm actually going to get that out of the way so I have a bigger field there. All right. All right, so I'm going to use this as my garbage at the end of the bed here for the flowers. Good enough. Okay. All right. So with my sterile kit, I can't touch within an inch of the border, so I'm going to grab this away from me, this side, here, and then I'm going to like so. And the same goes with the linear saver pad here. Can't touch within an inch of the border. And then with this, I want to put the linear saver pad underneath here. All right. Try not to have my gloves touch my sterile field, so I'm going to grab with my non-dominant hand here. Okay. And keeping my thumb away. All right, so I got that. Okay. Now I'm going to move this like that. Alright. So I'm going to open these swab sticks here. Trash. Get them out from there. Trash. I'm going to take my lube here and I'm going to open it and I'm going to put it in the corner here. I'm going to take off the wrap on this. Don't want to break sterility, and I'm going to just kind of check it, make sure everything's intact. Drop. All right, I'm going to grab the syringe here. Attach that on, like so. And I'm going to try to keep in there. And it looks like I have everything good, so I can put that, grab that, and I'm going to put this on my sterile field over here. And then I don't want to break sterility, so I'm going to move the patient's like that. Alright, and then I'm going to still sterile here, so I'm thinking I'm going to go like this. Alright. Oh, don't want to break sterility, but I need a little bit more room. Alright, so first things first, I'm going to commit with my non-dominant hand. I'm going to hold the labia, and then I'm going to clean. So I am going to go far down outside of my sterile field, drop. Close to me, on my sterile field, down the center, and then I'm going to look for a wink. I'm going to go around, drop. So then I'm going to take my catheter and I'm going to dip it in the lube here, about 6 inches or so. I'm going to have the patient bear down like they're about to urinate, and I'm going to put it in 2 to 3 inches until I feel a little retention. And then once I do, and there's a little urine coming out, I'm going to put it in another 3 inches. All right. And then I am going to inflate the balloon. Okay, well, this is, there we go. So typically, if this would happen, I would inflate the balloon, and the balloon that is inserted in the vagina would inflate. Instead, there's a faulty Foley and it's inflating there. Just gonna keep going. So then with that, it's inflated. So I am done with my procedure there with a sterile procedure, so I'm going to take off my gloves. Drop. And I'm going to remove that. The water might come out. And I'm going to tape it to the leg with a little bit of slack there. And I'm going to grab my tape. Again, I'm going to leave a little bit of slack. It's a little too much slack, I feel like, so I'm going to make it a little bit tauter. About like that should be good. Oh, my tape's not cooperating. Alrighty, and then when I get their bag, I'm going to come over here and I'm going to hang it on a non-movable area of the bed. But first, I'm going to actually write my name, date, and the time on there, and I'm going to notate the color, clarity, and the volume of the urine that's already in there. And it's about 100 mils, and it's clear, and it's a light yellow. So again, I'm going to come over here and I'm going to attach it to a non-movable part of the bed. Right there, perfect. Alright, so I have that strapped up there. I can actually clean up my playfield here. Get this out of the way. And grab this. And then I'm also going to make my patient comfortable and get them situated here. I'm going to do this. And while I'm doing this, I'm going to educate the patient, and I'm going to tell them that, oops, goodness gracious. Okay, well, all right, so I'm going to get them all covered up and ready here, and then I'll educate them. All right, so we're comfortable, and I'm going to tell them that the bag should remain at waist level, and it should not touch the floor, and to drink a lot of fluids, and I'm going to lower the bed. I'm going to tell them if they have any problems at all to hit the call bell. And I'm comfortable. Drop it down. Don't touch anything. Alrighty. That's it.